Thank you for watching the annual colposcope update training video. This is the nuts and bolts of the colposcope video and is meant to be watched every year just for an update. So we're going to go from the very beginning and cover the very basics of how to use the colposcope. And we're going to start as you would as you found a colposcope in each suite when you arrived for a case. When using the colposcope and touching any part of it, we should always be wearing gloves. And the first thing that we will do is turn the screen on by pressing and holding the standby button. While the colposcope is loading up, we will discuss the colposcope cover, which are found in the Scene Safe packs called clear plastic colposcope cover, and they can be taken out just by opening the packet. They can be placed over the colposcope. They have got two openings, one at each end, a large one which is meant to go over the whole colposcope and a small one which is just for the lens to fit through. So we place over the colposcope as such, and then the lens will peek out of the little opening, and that is how the colposcope can be used. Any of the adjustments that I'm about to do now using these functions here, the zooming in and the on and off, including taking the colposcope off its stand, can be done with the cover on, but for clarity and so that it's easier to see, we will do it on the training video without the cover on the colposcope. So, for the first part of the video, we're going to look at how to adjust the colposcope. These new colposcopes can be used handheld and do obtain very good images if used as such. They can equally be used on the stand as a freestanding colposcope. The first adjustment that should be known about is that the height of the colposcope can be adjusted by twizzling this setting here, which is this round white piece of metal, allowing the colposcope to rise up and down, which is ideal for adjustments for the height of the bed. It can then be tightened to stop the colposcope rising up and down. The next adjustment that can happen is the knob at the front of the colposcope, which can be turned to allow lateral rotation of the colposcope and then tightened back up. The next one is this one here on the right hand side, which can be loosened to allow complete and utter free motion by loosening this ball here, and again can be tightened back up. But the one that's most likely to be used and most often used is the function on this side of the colposcope here, which allows for the colposcope to be taken off. So untighten it, which allows this to release, and then twist the colposcope and lift. Please do not pull the colposcope backwards, because otherwise it risks damaging this connection at the front. Damaged connections are one of the most common reasons for the colposcope to fail. Once the colposcope is removed, it can be used as freestanding in order to prevent catching patients' or clients' faces. If it's already recording, please remember to always point it at the floor. To attach it back onto the stand, it's the same but in reverse, so tilt the colposcope, slide it in, and then tighten the mounting. And they are the adjustments of the colposcope. By now you'll see that the colposcope screen has loaded. The username will be auto-populated each time the colposcope is turned on. You will need to enter the password using the keypad. And then click on OK. It will take a little bit of time for the colposcope to load. And as it's loaded, it will then begin to show what is displayed on the actual colposcope. The colposcope itself can be switched on using the yellow triangle. Press and hold until the screen illuminates. That is now on. And if you look back at the screen, this is the time it is allowing you to enter the client's details. Please click on New Patient. And here we are going to enter each client's unique code, which is always the doctor's initials followed by the client's initials, followed by their SARC number, and then click OK. At this point, the colposcope will move to show you what is now displayed on the screen of the colposcope. And as you can see, what is displayed on the screen of the colposcope can now be changed by zooming in with the plus button or zooming out with the minus button, and the degree of zoom will be displayed to you when looking at the screen by this number here in the bottom corner. It should be noted that this ring, which can happen around the edge of the colposcope, is a common occurrence that people do not wish to have and can be removed by zooming in, which is the plus sign on the colposcope itself. It is safer to use the colposcope zoomed in on handheld mode, as it is at this time that you're less likely to catch an image of the client's face. This can also be avoided by pointing the colposcope directly at the ground, as we've mentioned already. So at this point we are now ready to record the actual examination, and it's important before we do that to white balance the colposcope. The way in which this is done may differ slightly between machines, but it is a button here on this one. It's pressed to say white balance, and you'll see on the screen it says white balance manual. So the colposcope and the images have now been white balanced. The light on the colposcope can be adjusted using the brightness for more or less light. So to turn the light on, we press this. You can see here that the light is now on. To increase the brightness of the light, we will press the same button as many times as you wish, and to decrease the brightness we can hold the opposite button, and indeed this will turn the light completely off. So before the examination is recorded, it's important to record the images of the client details and their SARC number for proof that this is the correct client, and also the colour sheets for proof that what we are seeing and calling, for instance, red, is red. This can be done the same way as any of the recordings would be done, and it would be held in front of the colposcope while pressing record on the screen, passed in front of the colposcope, and the same for the colour balance. Now it's clear here that sometimes it takes the colposcope a little while to focus. You'll notice that the best way of dealing with this is actually to hold still. The colposcopes are designed to autofocus, and the more movement that there is, the harder they find it. So one of the common reasons for images not being in focus is that there is too much movement, which in practice we appreciate is very difficult if patients are moving around. But as you can see, if you hold something still for long enough in front of the colposcope, it will autofocus. At this point, you can stop the recording, and you are ready to actually record any part of the examination you may wish to. This can either be done by moving the colposcope on its stand over to the bed, and then a doctor could use the colposcope on their own, or it could be done with the colposcope, as we said before, removed and used as a handheld colposcope. If we are doing that, it would be appropriate to take the colposcope off, to aim that the desired area for imaging is in the centre of the screen, and that the handle is always pointed down to the floor, allowing for the image to maintain orientation of the clock face as we would describe in a statement. If the handle is turned, we can see that the image loses its orientation. And also, if we don't stand directly in front of the client, again, we can see that the image loses its orientation. So trying to stand directly in front of the client, centralising the area of focus on the screen and keeping the handle pointed down to the floor where possible, although in practice this can be difficult, is the best way of using the colposcope in its handheld function. Following that, the record can be stopped as before by pressing the record button at the top of the screen, and the colposcope can be mounted back on its stand as we did in the start of the video. That leaves us with some troubleshooting for the colposcope. Common reasons that the colposcope might not work is, as I said in the beginning, is loose connections, and the most common reason for having loose connections is if the colposcope is moved forcefully. And we appreciate that moving the colposcope when the room is very busy is very difficult, but to try and treat the wires as kindly as possible is important in maintaining its ongoing function. The common connections that may fail might be this one here, and there is a connection here right in the very back of the colposcope where two leads go together, and this is often the one that comes disjointed if the colposcope is pulled away from the wall quickly. The other issue with why the colposcope might not work is this green button here at the top, which should not be pressed. However, if the colposcope is failing to turn on, it would be worthwhile trying to press the button to see if actually it's already been inadvertently pressed and turned off the power to the trolley. I think this pretty much covers the use of the colposcope. It would be what to do with the images following the examination, and it would be after you have completely and utterly finished and decided that there is nothing further to do, to click Finish up here. You can see you have two images here. The first one with the colour balance and the code, and the second one of the examination, and then to click Finish and go into advanced mode, which will allow you to see the images that have been recorded up here. You can see that they are your images because they have the code, the time at which they were taken, and then the videos can be reviewed by double clicking on them. It will ask if you wish to download the video, as we are now using the end-to-end encrypted server. We do wish to download the video, so we would click download. It may take a little time, and then the video itself will appear on the screen and can be viewed. This can be paused at any moment, and if so wished, a still image can be obtained. So two methods of taking still images would be during the examination, at which point you would click on the freeze button, which is next to the record button, as you will see earlier in the video, or even more ideally at the point after the examination, clicking the coloured square as can be seen here. And the still image will then appear up here and can be seen. So whereas we may write something like good image of bruise at 23 seconds, if this was the case, you could go through the video, pause the video at 23 seconds and take a still image of the bruise, and it will appear in the same file, which may well be a useful tool. At this point, if you've reviewed all of the images, it's important to document in your contemporaneous records the quality of the images, whether you've seen on the DVD what you've seen with the naked eye, and document any discrepancies so that this doesn't become an issue at a later stage. And once that is done, if you are happy that you have the images here with the quality that you want, and they are recorded in your contemporaneous records, fully documenting any discrepancies, then the work with the colposcope is complete. At which point, because we are now end-to-end encrypted and it shouldn't be routinely necessary to burn DVDs, you can simply close the colposcope and shut it down. You will also turn off the handset of the colposcope by simply once again pressing and holding the yellow triangle. If there's any questions about the training of the colposcope video, please feel free to ask either myself, any of the other day team, or the crisis workers who will have all had recent face-to-face training on using the colposcope. Thank you.